Hello, everyone. Today I'm going to talk about a healthcare policy that impacts patient care, access, and nursing practice. Specifically, Medicare observation status and the Two-Midnight Rule. Healthcare policy plays a major role in how patients receive care, how services are billed, and what resources they can access after discharge. This policy is especially important because it affects how patients are classified in the hospital, which directly impacts both their cost of care and their ability to receive follow-up services. It also creates lots of confusion for patients because what they experience doesn't always match how their care is classified. This policy was created in 2013 by the Centers for Medicare and Medicaid Services. It's known as the Two-Midnight Rule. It helps determine whether a patient should be admitted as an inpatient or placed under observation status. If a provider expects a patient to need hospital care for at least 2 midnights, they are admitted as an inpatient. If the expected stay is less than 2 midnights, the patient is placed under observation status. Another important point is that this isn't always clear-cut. Some patients fall into a gray area, where both clinical judgment and reimbursement considerations can influence this decision. One of the most important things to understand is that observation does not mean admission. A patient can stay in the hospital, receive medications, labs, and monitoring, and still be considered an outpatient. From the patient's perspective, there is no obvious difference in care. But behind the scenes, there is a major difference in how the stay is classified and how it is billed. Observation status is billed under Medicare Part B, while inpatient stays are covered under Medicare Part A. This leads to higher out-of-pocket costs for the patients under observation status. Another major difference is that observation patients do not qualify for skilled nursing facility coverage unless they have a qualifying inpatient stay. So even if they were in the hospital for multiple days, they may not be eligible for rehabilitation services after discharge. Another important piece of this is how medications are billed. Patients under observation status may have to pay out of pocket for medications they receive in the hospital, especially if those medications are considered self-administered. This is something patients don't expect because they assume everything given in the hospital is covered the same way. So not only are they paying more overall, but they may also get a separate charges for medications, which adds to their financial stress. This policy mainly affects Medicare patients, especially the older adults. Many of these patients have multiple chronic conditions and are more likely to need rehabilitation or additional support after hospitalization. And this policy also affects nurses because we are responsible for patient education and discharge planning. Hospitals are also impacted since this policy influences admission decisions and reimbursement. But it definitely affects older adults with complex needs. From my experience working in the ER as a patient access representative, I saw how confusing this policy can be for patients. Patients would be in the hospital for a couple of days, receiving full care, and naturally assume they were admitted, but later they would find out they were under observation status, which changes how everything is billed. I've seen how frustrating this can be, especially for older patients who are already dealing with health issues. There's really no visible difference in care from the patient's perspective, but financially and legally, there is a big difference. Something else I noticed is that patients rarely question their status while they're in the hospital because they trust that everything is being handled appropriately. It's not usually until discharge or when they receive a bill that they realize something is different. And by that point, there's not much they can do to change it, which can leave them feeling frustrated or even misled. One major implication for nursing practice is patient education and advocacy. Patients often don't understand the difference between observation and inpatient status. So nurses play a key role in explaining this and helping prevent unexpected costs. Another implication is discharge planning. Patients who need rehabilitation may not qualify due to their status. So nurses have to work with case management to find alternative options. This can delay discharge and make care more complicated. This also requires strong communication within the healthcare team and a good understanding of how policy impacts patient care. One major limitation of this policy is that it controls cost, but does not ensure access to care. Since patients can receive hospital-level care but still not qualify for needed services like rehabilitation. It can also create financial burden, especially for patients on fixed incomes. Another limitation is that the policy can shift costs from the healthcare system to the patient. So while Medicare may save money, patients often end up paying more. And using length of stay as a main factor doesn't always reflect the complexity of the patient's condition. This policy highlights how important it is for nurses to understand healthcare systems, not just clinical care. Nurses help bridge the gap between policy and patient experience. We advocate for safe discharge plans and help patients understand their care and support them in navigating complex systems. It also made me realize that how many patients may go through this process without fully understanding what happened. And as nurses, we are often the ones they turn to for answers. Overall, this policy shows how healthcare regulations can directly impact patient outcomes and access to care. Observation status creates hidden barriers that patients may not fully understand. As future nurses, it is important that we recognize these challenges and continue to advocate for our patients. Here is the official source from the Centers for Medicare and Medicaid Services to view this policy.